To begin this training series, let's discuss how to decide which type of analytic approach is best for your public health need or question. The best analytic approach depends on the type and timing of your public health question or the decision you're trying to make. For example, are you trying to decide between multiple possible interventions? Are you trying to improve your real-time situational awareness? Are you trying to predict future disease trends? Or are you evaluating a past public health action? Each of these could require a different type of modeling approach and output. Another factor is how much time you have. How quickly you need information to help make a decision or inform the public could impact which type of analysis or modeling output you select. For example, some types of analyses, models, or forecasts can be generated quickly, whereas other, more sophisticated outputs take longer to conduct, build, and validate. The amount and quality of information and data available is also important. If it's early on in an outbreak or you're dealing with a novel pathogen, there might be less information or lower quality information available compared to a situation like routine seasonal respiratory virus surveillance. Different types of analytic outputs are useful at different time horizons. The term horizon refers to how far in the past or future you're considering. In this series, we will discuss 4 different types of outputs that are appropriate at different time horizons of an epidemic curve. First are qualitative assessments. These are rapid analyses of potential outbreak trajectory and risk posed to a given population and can be used at any time horizon, including very early in an outbreak when data are limited, and revisited at any point as more data become available. The next are nowcasts, pointed out in green. As the word now in the name implies, they are helpful in the present to estimate real-time disease burden based on partially reported data. The third are short-term forecasts, pointed out in light blue, which are useful in the very near future for predicting disease burden in the coming days and weeks. Last are scenario models in dark blue, which are used to compare different potential hypothetical versions of the longer-term future, or scenarios based on varied assumptions, including factors such as what public health measures are applied or how rapidly the pathogen evolves. These could be useful in months into the future or even into the past. Importantly, these outputs are not mutually exclusive and can be used together or at different points in the decision-making process. For example, a short-term forecasting model might be adapted for scenario modeling or might have a nowcasting model as one component. In this series, we'll cover each of these output types in more detail.